It was all triggered by the deaths of a married couple in early July. They were pronounced dead on arrival at the hospital within a week of each other. And within a month, there were numerous other such DOA cases. It drew enough concern that even officials from the Centers for Disease Control have been brought in and continued to investigate. What's striking is that of the 119 COVID deaths from the 4-month period from July 8th to November 19th, nearly 40% were dead on arrival cases.
It's heavily skewing disproportionately with Pacific Islanders, Micronesians, and especially Chuukese. By sex, what we're seeing is it's heavily skewed towards males for both dead on arrivals and the non-dead on arrival cases, but even more so with the dead on arrivals. You know why? Men don't go to the hospital until it's too late, or the doctor. By age, we're also seeing it's heavily skewing towards elderly people in both categories, the dead on arrival and non-dead on arrival cases. But there's more in the dead on arrival cases of middle-aged people, 40 to 59. Most of the cases in both instances are from the north, our most populated villages, but we see a slight difference with slightly more coming from the south with the dead on arrivals. Not sure why.
But the biggest takeaway for Dr. Pobutsky?
82% of the dead on arrival cases were unvaccinated compared to 58% of the non-DOA cases. So that's definitely a risk factor.
The data is just a preliminary look as the CDC team continues to look into the DOA phenomenon.
We should get a lot more detail on this as this investigation unfolds in the next couple of months.
In the meantime, they're planning more outreach to increase COVID literacy among those who should get treatment but aren't.
We had 2 press conferences, one at the end of August and one in early September, to kind of alert the community about this, because at the time, monoclonal antibody treatments were available at all of the hospitals, and there's no reason, people could get the treatment right away.
For Guam's News Network, I'm Nestor Lecanto.